Let's bring in NBC News medical contributor Dr. Uche Blackstock. She's an emergency medicine physician and the CEO of Advancing Health Equity. Dr. Blackstock, thanks for being here with us. So let's start right there with masks. Tom just laid out lots of mandates being rolled back in places like Washington, D.C. Places also no longer checking for that vaccine requirement at indoor dining locations. That could be ending this week. He also just said there, though, something interesting at the end, which is that health experts are urging caution, which sort of starts to lead to this confusion. What do you think about that confusion, and do you think it's the right time to roll back these safety measures?
Good morning, Savannah. Thank you for having me. I agree with my other colleagues that it is a confusing time, and we definitely need to be cautious. The reason why I say this is because cases are still high, even though they're dropping, and transmission levels, as Joe mentioned, are substantial to high. And at those levels, CDC recommends that 99% of counties should be wearing masks. So I do think that there should be some data-driven mask policies, like below a certain number of cases, below a certain amount of hospital capacity, as well as at a certain vaccination rate, then masking can come off. Until that point, masks stay on. And at this point, we are not out of the Omicron surge yet. And so we have to be cautious.
Now let's talk about schools, doctor. So some are rolling back their mask mandates, that then states like California say they're going to keep it in place for at least another couple of weeks. We just heard from the state of Illinois and what they're planning to do. They're saying schools are just different. Kids are younger. They're in their classrooms for hours a day. When do you think mask mandates should be lifted? And what kind of difference in transmission are we seeing at schools with mask policies versus those without?
Right. And so we have some data from the CDC showing that schools that do have mask mandates have lower rates of outbreak. They also have lower risk of pediatric hospitalizations. And so that we know that masks are effective. And then there's another study that came out recently that showed that people who wore high quality masks were less likely to be infected. So schools by nature are high risk settings, and we need those multiple layers of mitigation to prevent the transmission of infection. Again, I think we should be looking at transmission levels in the school and the community, as well as vaccination rates in the school to determine whether masks come off. And so that's going to vary locally on a local level. But I think schools need that guidance from the state and the CDC to determine when those masks come off. So we need those metrics to drive those policies.
Absolutely. Before I let you go, I do want to ask you a viewer question. This is Sean in Hawaii. He writes, in March 2021, I got the J&J COVID vaccine. In October 2021, I got a Pfizer COVID vaccine booster. I saw on the news that a mix and match of different types of COVID vaccine boosters can induce a higher efficacy. Can you explain that? What do you say to that, doctor?
Yeah, so Sean is referring to those mix and match studies that actually show that when you get a booster that is a different platform, so say, for example, mRNA versus the adenovirus platform that you see in the Johnson & Johnson vaccines, that you do get a higher antibody response. And so definitely mixing and matching between Johnson & Johnson and mRNA vaccines makes sense. However, mRNA vaccines, mixing the different brands, Moderna and Pfizer, really don't give an appreciably different immune response. So, what Sean did makes sense. But I would say for people who've had an mRNA vaccine, you don't need to boost with the Johnson & Johnson.
All right. Wonderful. Dr. Uche Blackstock, thank you so much. And if you have a question for one of our doctors, like we just got the answer to Sean's question, email us at morningnewsnow@nbcuni.com with your questions. And please do let us know if you'd like to stay anonymous.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.